Hi there, I'm Dr. DeHennens, and today I'm going to teach you how to use ultrasound to get an IV on a patient. We tend to need to do this in patients that are hard sticks, people that are dialysis patients, people that have had multiple sticks in the past. So this is a good tool for nursing to be able to use to get IVs in these types of situations. First thing that we're going to do is we're going to introduce you to the machine. This is our Sonosite machine. We have the same machine at Memorial and at Granger. This machine has 3 different probes on it. The probe that we're going to be using is the linear probe. It's linear because on the top of it it's a flat surface. And this is just much better at looking at soft tissue and more superficial structures such as the veins in the arm. The first thing you're going to do is turn the machine on. So there's a power button that's right behind the screen here. It will take a second for that to load up. There's 2 different screens that we have. So this screen is the control screen that will adjust our various settings. And this screen is basically what we're seeing with the ultrasound itself. So when the machine first loads up, you're going to get a screen here that has 4 options. What you're going to want to do is you're going to want to hit this one here, that's the select transducer and exam type. So when you click that, it'll give you a list here. So there's 3 different transducers, and again, this one in the middle is our linear probe. It looks just like the probe that we have here. And on here it says L25, and so up there it says L25. We're going to scan down, and at the bottom there's an option for venous. These various options, they give a similar look, but this is going to be the best one for finding a vein. So when we click that, this is our control screen. And our control screen has a lot of different options and settings on it. There's really only 2 main things that we need to worry about. Number 1 is the depth. So the depth is this line here. So right now it's set at 3.1 centimeters. And it's a touch screen, so you can scroll up or scroll down to go deeper or more shallow. So when you scroll up there now, we're at 2 centimeters. The other thing is the gain. So that's this button right down here. It's also a touch screen. And if you scroll it to the right, it'll make the screen a little bit brighter. If you scroll it to the left, it'll make it a little bit darker. The majority of the time, you do not need to adjust the gain. It will be set right in the middle, and that tends to be good enough for this procedure. What I'm going to do is I'm going to prep the patient. So you're going to prep the patient just like you would any IV that you're going to start. So I have all my items set up here in order to get ready. Now, we're going to look first, and you should always look before you poke, and we're going to look and see what our best option is. The anatomy of the arm, we have multiple choices that we can use. The ones that tend to work best and that I look for is the basilic vein. And the basilic vein runs right along the inside of the arm. And then you can look also for the cephalic vein, which runs along the outside of the arm and the top of the arm. The basilic vein tends to be the vein that is the largest and the easiest in order to find. Then you also have an option for the deep brachial veins that are right in the middle here. The problem with the deep brachial veins is that they are deeper and they're next to the brachial artery, so you run that risk of puncturing the brachial artery. So my choice is always to look for the basilic vein first. So in order to get a good look, we need to use the ultrasound gel. And you can use either the ultrasound gel or you can use the lubricating gel that we have in each of the rooms. Some people use a tegaderm to put over the top of the probe. The manufacturer doesn't recommend that we do that. So I would say if you don't need to use it unless you're at a really high risk of communicable disease, I would just either use a probe cover, which we have in the various ERs, or just use the probe itself. So I'm going to take a look. Like I said, we're going to look at the basilic vein first. So I have my setting set at 2 centimeters deep. So when I look at the main screen here, there are 2 things that you need to look at before you even get started looking. Number 1 is over here on the far right, that's our depth. So down here again it says 2 centimeters deep, and then there's notches on the way down. And that tells us that we're 1 centimeter deep right there. So that gives us a good gauge as to exactly where that vein is and what we need to anticipate our depth to be. The other thing is up here on the top left corner, there's the little sonocytes label. And what that does is that it correlates with the probe itself and as to what your orientation is. So on the probe, there's one side of the probe that has a little knob on it. The other side does not have that knob. That knob correlates with that label on there. So when I'm looking at the patient, it's lined up just like this, where that side correlates with that. Now when we're doing an ultrasound guided IV, or when we're doing any kind of ultrasound procedure, we point that knob towards the patient's right side or the patient's head. So if we're looking at a transverse view, we always want that knob facing the patient's right side, because that way we always know which direction we're moving when we're up on the screen. So let's take a look at his arm here. So I'm going to look down here at the basilic, in the region of the basilic vein. And so you're going to use your left hand, because if you're right-handed, you're going to be starting the IV with your right hand. I always recommend kind of putting the cord kind of around your elbow here a little bit to keep it out of the way, so that it's not getting in your field. When you put the probe on the patient's arm, place the probe at a 90-degree angle perpendicular from the patient's arm. And I usually put my pinky finger or a couple fingers down on the arm in order to stabilize it. What you run the risk of is if you just hold it, is you're going to slide all over the place, and you're not going to really be able to keep your view when you find it. So I put my pinky finger down, and when I scroll onto it, I find a structure on my screen here that is round, and it's dark, it's black. So anything that is liquid comes up black on ultrasound. So this is a vein, that is the basilic vein that we're looking at. When I look at my depth, I am 1 centimeter deep, and I have a pretty good sized vein. Now I can change my depth around on my screen, and it makes the vein look smaller, and it's still, you can look over here at the side and see exactly how deep you're at, so still at 1 centimeter deep. To have the best luck at getting your IV, you want that vein to be as big as possible. So I try to zoom in as best you can. With deeper veins, you may need to go a little bit deeper than the 2 centimeter depth, but usually between the 2 and the 3.1 centimeter depth, you'll be able to see most of the veins in the arm, especially the veins that you'll be able to get with the ultrasound, because of how deep it is. So I'm going to take a look here also a little further up his arm, so that we're looking at a couple of other veins here. So he has a couple of superficial veins that are closer to the top. Let's get some more gel on here. So we're looking here, we have a couple of veins here that are superficial, and then when I turn over here a little bit too, there's some structures that are deeper. When I hold compression down, notice that that structure there is now pulsatile. That is his brachial artery. When we scroll back over here to these superficial structures, and I compress down, they compress, and those are veins. So make sure when we're looking at some of these deeper veins, so right here he has a deep brachial vein that's right next to the brachial artery. Those tend to be tougher because you're right next to that artery. So I don't recommend going there first, especially if you have various other options. Okay? All right, so we're going to come back up to where that brachial artery is at. I'm sorry, the basilic vein is at. So what I have here is a longer IV catheter. These are 48 millimeters or 4.8 centimeters long. So we need to make sure that we're going at a vein that we can get the catheter in and thread the catheter through, and not just have a very small portion of that. So I'm going to put this on here again, and we are 1 centimeter deep. So what we do is when we start the IV, we're going to make our puncture the same distance as our depth. So in this case, 1 centimeter deep. We're going to go about 1 centimeter back on the patient's arm and go at a 45-degree angle so that the needle should go down and meet the vein at that exact location. So getting very nerdy and using math, this is Pythagorean's theorem. We're creating a right angle, a right triangle, and the hypotenuse is going to be your needle going into the vein. So I'm going to clean the patient's arm up here because you don't want too much goop around the area, because if you have too much of that lubricant, when you go and try to put your tegaderm on there and fix it, it won't stick very well. So make sure you have plenty of 2x2s around the patient. Go ahead and lift your arm up. I'm going to put a towel underneath them. Go ahead and put your arm down. All right, so I've got everything ready here. Needle ready. So my knob is facing the right arm, the right side of the body. Again, I'm 1 centimeter deep. So looking at the patient's arm here, I'm going to make my insertion at about 1 centimeter back. You're going to feel a poke. 1, 2, 3, poke. And then we're going to look at the screen. And on the screen, we're going to see movement because our needle is coming down into the area of the vein. You'll want to look mostly at the ultrasound machine. So when I'm coming down, you see how the needle is just to the side of the vein. So I'm close, but I'm not quite there. So I'm going to pull back just a little bit, readjust my angle, which I know that I have to go to the patient's left because I was a little bit to the right on the ultrasound. So I'm going to adjust. So now I'm right on top of the vein. You can track back and see that bright white that's right on top of the vein. That is the needle tip. So I'm going to poke into the vein. Not have my flash of blood yet, so I'm still right on top of it. All right, and there's my needle tip in the vein now. What I do is then you're going to drop your angle a little bit. I advance forward just a touch because you have a lot of soft tissue that you're going through. You see the needle tip is in the middle of the vein. And now I'm going to thread the catheter. So again, we had blood draw back. All right, now we're going to check and make sure that it's flushing okay. It's flushing fine. Now there is a way with the ultrasound that you can confirm that you are in the vein as well. So what I'm going to do is I'm going to take a look at that vein. And I can see the catheter is in that vein. You can kind of see a little white spot that's near the middle of it. And I'm going to flush. And so when I flush, you're looking for fluid surrounding the vein. Now right now when I flush, you're going to see kind of a swirling inside the vein itself. So see how there's just kind of that swirling inside there. The other thing you can do is you can turn it the other way, so turn it 90 degrees. Pointing it towards the patient's head, and I'm looking for the vein here. There we go. So you can see the catheter in the vein, so the bright white is the catheter. You can even see the catheter tip in there. And then when I flush again, you see that swirling just at the end of that catheter tip. And that's where my saline is flushing in. So then you can secure the IV as normal. Just make sure you use some 2x2s or 4x4s to clean up the ultrasound gel or lubricant from around the area, because otherwise your tegaderm will not stick. And then you can use the IV. Now when you're complete, when you're done with this, make sure you clean the probe. You know, again, sterilization is very important. We're using this on multiple patients. The way that we clean this is we use hydrogen peroxide. So each of the carts should have hydrogen peroxide in it, and use a washcloth with hydrogen peroxide to clean it off. Do not use the purple sandy cloths to clean it off. Okay? Also, when you're using the machine, make sure when you're done that the cords are up and above the machine so we don't run it over with the wheels. We need to take care of our equipment and make sure that it works for the future. Okay? So that's how you start an IV using ultrasound, and we'll continue to work with you to get you proficient at it, okay?